और स्पेसिफिकली हम जिस ब्रांड के बारे में बात करेंगे वो Lipolab है. Lipolab is a fat dissolving injection, so you'll get knowledge of both what a fat dissolving injection is and the benefits of using or preferring Lipolab over other brands. So all the points will cover both of the aspects. Benefits of fat dissolving injections are numerous. Firstly, it's a non-surgical adipose reduction treatment. यानी कि आपके जिस्म में से चर्बी तो कम होगी मगर कोई सर्जरी के बगैर. Surgery costs a lot and it costs a few minutes. It provides a minimally invasive. It's a non-invasive treatment नहीं है. It's a minimally invasive treatment. यानी कि injection होगा, which is an alternative to surgical procedures like liposuction. It's an alternative to surgical procedure like liposuction in all the ways, reducing procedural risks and recovery time. एक तो उसमें anesthesia, GA उसके अपने risks होते हैं, फिर उसका अपने recovery time होता है. उस सब से आप जो है बच जाते हो. Secondly, localized lipolysis. Localized lipolysis का मतलब है कि टारगेट एरिया पे जाके काम करता है. टारगेट स्पेसिफिक एरियाज ऑफ एडिपोज टिश्यू, फॉर एग्जांपल सबमेंटल रीजन यानी डबल चिन, एब्डोमेन स्पेशली लोअर एब्डोमेन, थाइज, बाइसेप्स, ये वो सब रीजन है जिसके ऊपर टारगेट फैट होता है. यानी कि आप इसको अपने हाथ में पकड़ के फील कर सकते हो. इट डजंट रिस्पॉन्ड वेल टू डाइटरी एंड एक्सरसाइज मॉडिफिकेशन. आई हैव सीन लॉट ऑफ वेरी स्किनी गर्ल्स हैविंग डबल चिन. मे बी इट्स जेनेटिक और बिकॉज ऑफ देयर लाइफस्टाइल. सो इन एनी केस यू कैन जस्ट गो इन टारगेट एरिया को जाकर एड्रेस कर सकते हो. थर्ड इज रेपिड रिकवरी. Moreover, very minimal downtime is required, allowing most patients to resume activities of daily life shortly, immediately after the treatment as well. Also, it provides enhanced lipid metabolism. What does enhanced lipid metabolism do? It stimulates the breakdown and metabolism of adipocytes, which are the fat cells, facilitating natural excretion through lymphatics, the lymphatic system, and then ultimately it is excreted out from the body as well. Also, it provides improved aesthetic contouring, especially which is especially beneficial for small persistent pockets of fat. For example, adipose deposits under the chin. It enhances body contouring and definition in all aspects. There are people I've come across who are regular, who are very regular at gym and diet, but they still have this lower belly, or they have their buttocks, or they have their double chin that doesn't get treated in any way. So let's come to the expected clinical outcomes. Number first is reduction of adipose volume. It causes noticeable reduction in localized adipose tissue, which results in varying based on metabolic factor with factors, treatment, area of intervention, and the number of session. The number of session is a very important thing over here. You won't see magical results in one session. It's not magic. It's a treatment. It requires sessions, right? So a progressive improvement is the key point. Initial effects can be observed within a few weeks, usually 3 weeks, but they're very mild, with optimal outcomes often achieving after a series of treatment, usually 2 to 3 sessions, but it depends upon the amount of fat a person has. It may require up to 8 to 12 sessions, but for a small area like double chin, 2 to 4 sessions are enough. Also, it has very sustained results. Why? Because adipose destruction is permanent. However, if you go into calorie surplus, adipose tissue in untreated area may expand with weight gain. It is not the new adipocytes form very easily. The other ones that went undestructed, they expand. Now let's talk about prognosis and post-treatment considerations. Firstly, we should have a positive response in most cases if the procedure is done the right way. High patient satisfaction is reported usually due to the significant improvement in contour and reduction of adipose volume, especially in the target areas or the treated regions, right? So overall, it adds a very positive impact on the patient's personality. That stubborn fat gets lost immediately, and then the person is motivated to do the rest of the things as well. Also, about multiple sessions, for optimal lipolytic effect, several sessions may be needed, spaced weeks apart to allow for metabolic clearance. The minimum number of weeks between one session and the other is 3 for metabolic clearance and lymphatic drainage and this and that. Maintenance through lifestyle is very important. I'm not asking you to starve and shift to gym, but for optimal long-term results, they are best maintained with a healthy diet and regular physical activity, as adipose expansion can occur with the remnant adipocytes. Okay, and if you gain a significant amount of weight, then of course the rest of the adipocytes will expand and the new cells may form as well. Transient adverse effects. The transient adverse effects are with every minimally invasive procedure like this one, but the potential side effects may include localized edema. So don't be afraid of that. Don't think that you're actually gaining weight or fat. That is edema. That is water. Ecchymiosis or mild discomfort. Ecchymiosis or mild discomfort. I'm sorry, I pronounced it wrong. Generally resolving within a few days to week. Usually takes 3 to 4 days as my experience and my patients' feedback. In a nutshell, Lipolab, the brand that I mentioned earlier, fat dissolving injections, they offer an effective option for localized adipose reduction with minimal recovery time, minimum downtime, through multiple sessions, multiple treatment sessions. It is not about 1 or 2 sessions. It's not a radical, it's not a magical treatment. Multiple sessions and a healthy lifestyle is recommended to maintain the results, because once a patient has achieved the result, he wants to sustain it. So it's better, so he is actually convinced to stick to it. Okay, that's all for today. If you have any queries, just ask me in the comment section and tell me about my mistakes as well. Thank you so much. It's Dr. Nimra signing off.